Hello and welcome to Health Live at Seniors today. We are delighted to have here with us once again. The once again is actually perhaps for the eighth time. We are having Dr. Aditya Agrawal. Uh, Dr. Agrawal, good evening. How have you been?
Hi, I'm very well. Thank you so much for inviting me once again. I actually I enjoy speaking at this fora. It's just so much, gratification to help explain to patients what respiratory diseases are and how they actually impact your life. And getting better with them actually will help you with your quality of life. So today we're going to speak about breathlessness, and I think Mr. Maheshwari will tell you more about it.
Yeah, I'll actually first introduce Dr. Agrawal. Dr. Agrawal is a leading consultant pulmonologist attached to several large hospitals in Mumbai, specifically the Bombay Hospital and the Beach Candy Hospital. He is extensively trained in respiratory diseases, both in India and the US. His special interests are in difficult to treat cough, asthma, bronchitis, and lung fibrosis, and runs a specialized clinic for patients with chronic cough. He's a dedicated researcher and a peer influencer in the management of respiratory diseases. And above all, I must say that he is a friend of Seniors today. As you know, he has been here, as I mentioned, 7 times in the past, and this is his 8th appearance. And today, because this is the Asthma Awareness Month, we have requested him to speak about breathlessness. And is that asthma or something else? And this is, as you know, a very important issue that's there. And Dr. Agrawal is a specialist in this area, and it's only appropriate that we had him over for this session. Over to you, Dr. Agrawal.
Thank you.
So Dr. Agrawal will make a presentation right now. And those of you who have questions, as always, please put them in the chat box. And we will, in the Q&A box rather, and with your age and your gender, and we will ask them later after the session is over. Over to you, Doctor.
So today I'm going to speak about breathlessness, and what's very important to understand that in Hindi, we use the word dum for breathlessness, and breathlessness, dum has come to become synonymous with asthma. So a lot of patients come to us who are breathless, they come and tell us, Doc, I think I have asthma. They may be 70 years old, and it's extremely difficult to fathom that they may have asthma symptoms for the first time at the age of 70. So today we will go on a journey to understand what breathlessness is and how it is very difficult for someone to first develop asthma in their old age. Now, I'll just give you an overview of what we are going to discuss today. We're going to discuss what is breathlessness. What does anyone mean when he says, Mera saans phool raha hai? Then the next thing is we'll describe how one feels when he or she is breathless. We are also going to understand how someone describes his or her symptoms to a doctor, or how he or she would tell somebody else that they are feeling uncomfortable, which may mean that he or she has asthma. We are going to discuss the quantum of breathlessness. That means how breathless one is and how you can actually measure it objectively. Then we will understand the different causes of breathlessness. While we do that, we will try and explain how a doctor could possibly help you. And then at the end, I will speak about what are the preventable things that you can do to help with your breathlessness. Now, breathlessness is extremely frightening and a distressing symptom. Somebody who has been breathless will only be able to understand how difficult it is to breathe then, how difficult it is to be sitting, standing, doing anything that he is doing. Perception is the way we interpret any sensation, and even in breathlessness, it is how we perceive the symptom that we will be able to understand how breathless we are. There's a complex neurocognitive process involved out here, which involves how you are receiving the signals. That means how you are receiving signals which will tell you how breathless you are. And then this is processed in the brain to help you externally exhibit how breathless you will be. And this takes into account several parameters such as our past experiences, our mood, and our environmental cues. And how we perceive breathlessness relates to a range of multifactorial complex influences. Now, what is breathlessness? It is a subjective experience of a breathing discomfort that qualitatively that is qualitatively distinct, and it varies in intensity. It means every person will have a different experience of breathlessness, which is basically breathing discomfort, that will be different in intensity with each person, and it will be different in the way a person experiences it or feels it. And as I explained to you, it is multiphysiological. That means multiple parameters go into understanding how breathless you will be. There are several psychological, social, environmental factors which go into understanding how breathless you are. Now, this is a very complex diagram explaining to you how you will be breathless. So it depends upon what is happening in your lungs, what is happening with your respiratory muscles, what is happening in your tubes which take air from the outside into your lung. It also affects, rather it is determined by the central and peripheral chemoreceptors. These are the receptors which help you understand the subtle changes in the body. They all take signals to the brain, which processes the information and sends out these signals to the body, which in turn translate into breathlessness. Now, there are several descriptors of breathlessness. A patient, when he or she comes to me, I said, well, look for these little cues actually to help me understand how they are breathless. Some patients may say that my breathing is very rapid. That means मैं बहुत ज़्यादा तेज सांस ले रहा हूँ. Some patients will say that I find it difficult to breathe out completely. Some patients may just say that my breathing is very shallow and the air does not go all the way. सांस लेता हूं पर अंदर तक सांस जाती नहीं है. I cannot take a deep breath or my breathing is shallow. That means मैं बहुत छोटी-छोटी सांस ले रहा हूं, तेज सांस ले रहा हूं. Patient will say that my breathing requires more effort or my breathing needs more work. That means सांस लेने में बहुत काम या थकावट लगती है. Some patients may say that he or she feels hungry for more air or they are not getting enough air. That means the patient will say कि सांस लेता हूं but पूरा मन भर के सांस नहीं ले पाता हूं और सांस लेने का मन रहता है हर समय. Some patients may have suffocating symptoms such as they will say that I'm feeling smothered. ऐसा लगता है कि जी घुट रहा है. Some patients will say कि my chest feels tight. That means मेरी छाती tight लगती है. Some patients will say that my chest feels constricted. ऐसा लगता है कोई दबा रहा है या पत्थर रख दिया है. Some patients will say that I feel my breathing stops. मेरी सांस रुक जाती है. Some patients will say that I'm feeling suffocated. That means मुझे ऐसा लगता है कि मेरी सांस घुट रही है. Other descriptors are heaviness. Now, some patients may come and tell us my breathing feels heavy or my chest feels heavy. And this is a very common descriptor of breathlessness. The patient will say that मेरी सांस ऐसा लगता है कि बहुत भारी हो गई है या मेरी छाती में घुटन महसूस हो रही, मेरी छाती में भारीपन लग रहा है. Some patients may just come and tell you very easily that I'm feeling choked or gasping for air. And here the patient may say that मुझे ऐसा लग रहा है कि मेरा गला पूरा बंद हो रहा है. And some people may even say that I think I have to concentrate more at breathing. That means they will say that मुझे बहुत ध्यान से सांस लेने की जरूरत पड़ रही है. It's extremely important to understand each one of them, and for anybody who's listening to me today, they will have to factor in that anytime you have any of these symptoms, it just means that you are breathless and you need help there. Now, when should you see a doctor? Anytime that you have breathlessness, you should see a doctor and have it treated. An emergency would be when you are very breathless at rest or you are having severe breathlessness with chest pain, which may indicate that you may be having a cardiac disorder such as a myocardial infarction or commonly called heart attack, or it may even be in case of something called the pneumothorax where air fills around the lung. And another reason when you should immediately see a doctor in an emergency is when you are when you are breathless, severely breathless, and have an allergic reaction where you feel choked with or without swelling over your face, lips, etc. And this is called angioedema or anaphylactic reaction. Now, when I'm assessing a patient with breathlessness, what I would look for? I would look for when did it begin? Has it suddenly begun or has it been there for a very long time? And that can give me a cue as to what the cause of this breathlessness would be. I usually look for the level or grade of breathlessness, about how breathless a patient is. I look for the duration of breathlessness and for how long the patient has been breathless. And I would definitely inquire about how in the intervening period from the start till the presentation in the clinic, how the breathlessness has changed. We also ask about associated symptoms such as, does the patient have a cough? Does he have a dry cough or a wet cough? Does he have or does not have wheezing, chest pain, palpitations? We look for other symptoms such as sweating and several more. Now, when I'm grading breathlessness, this is extremely important, and I want everybody to either take a screenshot of this or learn it by heart. Now, when does one say that you do not have any breathlessness? When somebody is not troubled by breathlessness, unless he is doing strenuous exercise, which he is not accustomed to. A grade 1 breathlessness would be when you have breathlessness on walking fast or walking up a hill or an incline, which would also mean climbing a few flights of stairs. Grade 2 breathlessness is when you are walking on level ground, that means on a flat piece of ground, where you're walking slower than usual or slower than your peers, or have to stop for breath after 15 minutes. Severe breathlessness level 3 or grade 3 is when you are so breathless that you have to stop after walking 100 meters or a few minutes. And level 4 or grade 4 breathlessness is when you are so breathless that you cannot leave the home, or you are finding it difficult to do your day-to-day activities such as combing your hair, bathing, wearing your clothes, or doing any activity which revolves around raising your hands above your level of shoulder. If you want, I can repeat this. Level 1 or grade 1 breathlessness is when you don't feel breathless even while doing exercises or when you're walking up the hill. Grade 1 breathlessness is when you are breathless while climbing up a flight of stairs or walking up a hill or walking faster than normal. Grade 2 breathlessness is when you are walking on level ground, slower than usual or slower than your peers, and or you have to stop for breath after 15 minutes of walking. Grade 3 breathlessness is when you are having severe breathlessness while walking on level ground, such that you need to stop before 100 meters or after a few minutes. And grade 4 breathlessness is when it is so very difficult for you to leave the home because of breathlessness. Now, what causes breathlessness? And there are several causes of breathlessness. Now, if I were to tell you, there are psychological factors such as anxiety and depression, which can make you feel that you're breathless. There are lung factors, which are definitely lung diseases. There are chemical factors, that means there are internal system in your body has either more acid or more alkali, which is causing breathlessness. Then adaptation to exercise, and this is extremely important. What you need to understand that you may be breathless because of deconditioning or because of lack of physical activity, wherein this is a physiological breathlessness where you are not accustomed to a particular level of physical activity which causes you the breathlessness. Then you may have problems with your vocal cords and larynx which affect your breathlessness. And there are mechanical factors such as nasal obstruction, or you may have bone disorders, etc., which may make you feel breathless while walking. Now, to understand breathlessness better, if I were to just speak about lung causes, what we're looking at is things such as a severe breathlessness because of bronchitis, pulmonary embolism or lung attack, as it is commonly called, wherein you may have clots in the lung. You may have something called emphysema, which is usually or commonly called CO, which is a part of a disease called COPD, where people who smoke or patients who have been exposed to wood chula or have been exposed to any kind of burning material for a very long time develop this condition. You may have a condition called bronchitis, where your lung, the tubes are damaged and they open up in such a way that large quantities of mucus or bulgum is stuck inside your lung. You may have disorders of your pleura, which basically is a thin lining covering your lung, where diseases may cause water to collect around your lung. Cystic fibrosis is a complex genetic disease usually found in the white population, less commonly in the Indian population. Lung cancer, extremely common in smokers and now also in non-smokers. I did explain pneumothorax, which is air collecting around the lung, which may cause severe breathlessness. Pulmonary edema, which is basically a condition because of the heart or because of damage to the lung, which causes water to collect inside the lung. Now, there are mechanical factors which can also affect your breathing, which involves a humpback, kyphosis or scoliosis, where you have a crooked back, a crooked spine, which prevents your lungs from opening up and breathing in air. Then you may have complex diseases such as sarcoidosis and lung fibrosis. And more importantly, there are several infectious diseases such as pneumonia, tuberculosis, etc., which can cause breathlessness. And lastly, asthma, which I will discuss in a little more detail today. You may have heart-associated diseases also, which can cause breathlessness, where you may have vascular dysfunction or myocardial infarction, also called as heart attack. Pericarditis is when you have inflammation around the heart, or you may have conditions which are such as cardiomyopathies, where the muscle of your heart basically is diseased and does not allow the heart to pump as well, in a process also complicating the delivery of oxygen to the different organs in the body. Or you may have ventricular hypertrophy, commonly seen in patients who have uncontrolled blood pressure for a very long time. And lastly, cardiovascular diseases such as pulmonary hypertension, where there is increased pressure in the arteries between the heart and the lung, which tend to swell up and prevent easy or adequate oxygenation of blood. That means filling up of oxygen from the lung into the blood because of this condition. Now, there are other conditions such as anemia, which is lack of hemoglobin in the body, which can cause breathlessness. Obesity is an extremely important contributor to breathlessness. A condition called metabolic acidosis, where your body is more acidic, which results in breathlessness. Deconditioning is when you haven't been able to exercise enough, or over a period of time, because of lack of activity, your body forgets the amount of exercise it is capable of doing. Then there are several neuromuscular disorders, especially polio and myasthenia gravis, etc., which can cause breathing disorders. And lastly, and most importantly, anxiety or mental health associated reasons for breathlessness. And lastly, it's extremely important to dwell upon end-stage diseases such as cancers, etc., which cause breathlessness. Now, what is asthma and why it should be distinguished from the term dama? Now, asthma is a disease in which what we need to understand is a normal patient, a normal person would have the tubes in the lung looking like the one on the extreme left, where the tube is open in the center. There's enough space for air to pass through. There is very small, light yellowish rim of mucus, which helps to moisten or lubricate the airways. And then you have a condition where in asthma, where there's a reaction inside the tubes, where there is constriction of the muscles. The muscles are the ones which are surrounding between the orange layer and the outer red layer. These muscles are constrict and they close down the tube such that the amount of air passing through reduces because of the space constriction. And then when there is injury to these tubes, you have large amounts of mucus being formed. There is severe constriction of the airways of the tubes, which results in breathing difficulty. Now, what is important to understand is asthma is most commonly, I would say, is about 95% of the patients would have asthma because of allergies, where they would have allergies since childhood, complicated or associated with asthma. And anybody who comes to our clinic today with allergies, we ensure that we rule out asthma, because asthma is a very common condition, often misdiagnosed, and or rather, um, I would say the diagnosis is missed, because most patients would associate asthma only with severe breathlessness. Now, asthma may not only present with breathlessness. You may have symptoms such as a dry cough or paroxysmal cough, wherein you have multiple episodes of coughing when exposed to something. It is also important to understand that asthma is usually triggered. That means there is some external stimulus which affects your tubes of breathing, makes them constrict and produce large amounts of mucus, resulting in breathlessness or coughing or chest tightness. Um, how often have we seen somebody sleeping like this? Or does anybody you know who sleeps like this with several pillows? And today, why am I sharing this? Is because this audience today is predominantly that of elderly participants. And it is extremely important to make them understand that this does affect their breathlessness, and this is a common sleeping position for them to sleep in or their family members. Now, this is a condition where a patient is sleeping in bed, he has slept for about an hour, and then suddenly wakes up with a fright, feeling breathless. And when does this occur? It can occur in a patient with heart disease of several different varieties. This heart disease could be simple lack of blood supply to the heart, or it could be because of a valvular heart disease where the valve of the heart is not functioning well. It can happen very commonly in patients with high blood pressure, in patients with damaged heart muscle, in patients who have an irregular heartbeat, such as common disease is called atrial fibrillation, or it can happen in patients with mitral valve disorders. And this usually occurs because the pressure in the heart increases suddenly, and there is a severe fall in the oxygen during sleep. Now, how would a patient present? He would say that I find it difficult to sleep on my back. I usually require several pillows to sleep on. I cannot sleep on my back, or I sleep on my sides very often. And what are the signs and symptoms? He will complain of breathlessness, which improves when he's sitting up or standing. He needs multiple pillows. He has complaints of wheezing, which is a whistling sound from the chest, or rals, which are sounds as if bubbles are passing through water, or there will be dullness on examination. The patient may complain of a chest pain or coughing alongside his breathlessness. All right. Now, another factor which I wanted to bring in is sleep apnea. Patients with sleep apnea will also complain of feeling breathless when they are sleeping, especially such that they have to toss and turn in bed several times. They find it difficult to sleep on their back, and usually you find them sleeping on their sides or on their belly. Now, what if you know somebody who's sleeping like this, mouth open, several pillows, trying to raise his head up while sleeping, he or she may be at a high risk for sleep apnea. Now, what's important to understand is what you see on your left is that your tongue is an L-shaped organ. It's a mass of muscle. This muscle sits in your throat, in your mouth, and there is a sliver of air which passes through the back of your throat and your tongue, and this goes into your trachea or the windpipe. Now, with advancing age, especially in male patients or people who are obese, or in patients who have several other risk factors, what happens is the tongue falls backwards such that it blocks the passage of air between the tongue and the throat, which results in blockage of air. And this blocked air tends to vibrate at the back of the throat and causes vibrations which you and I perceive as snoring. This blocked air can have several disastrous side effects for you, and it's important that you have your sleep apnea corrected. Orthopnea, this is exactly what I was telling you earlier about shortness of breath on sitting on relieved by, sorry, this is platypnea, and this is when you feel breathless on sitting up and you are better when you're lying down. And this was a very common condition during the last pandemic of COVID, where patients were breathless while they were sitting up but felt better when they were lying down, especially with their face down. Now, there are other illnesses such as anemia, where there is lack of hemoglobin or low hemoglobin, which can also result in breathlessness, where a patient will also complain of accompanying symptoms of low energy, breathlessness, headaches, dizziness, and sometimes palpitations or increased heart rate. Now, how do you treat somebody with breathlessness? There's another important thing is obesity. And how does obesity contribute to breathlessness? In obesity, what happens is there is excess amount of fat around the chest wall, which requires the chest wall to do extra work. And hence a person perceives breathlessness, or because of the increased abdominal obesity, the fat pushes the diaphragm upwards, not allowing the lungs to expand adequately during inspiration, to cause breathlessness. Now, treatment. It's extremely important to understand that once a person gets breathless, unless the cycle is broken, his breathlessness will keep worsening. I'll give you a simple example. A person is breathless while doing exercise. He or she will avoid exercise. This will cause deconditioning. That means a patient will lose the ability to exercise. Then he will start doing only milder exercises. When he is breathless while doing mild exercises, he'll stop those exercises also. There will be further deconditioning, and this breathlessness will just continue, and it will affect his quality of life. Now, there are several factors which are important while treating somebody with breathlessness, and there are patient-related factors, there are condition-related factors, there are therapy-related factors. There could be a healthcare system-related factor such as wait times, etc., about how much time you have to wait to see a doctor, or failure of a doctor to explain the treatment benefits and potential side effects, or a patient-provider relationship is hoary. There are several educational steps which a doctor needs to explain to a patient while explaining how to manage breathlessness. And there are other factors such as socioeconomic related factors. Now, there are mechanisms of breathlessness, and important ones are mechanoreceptors, chemoreceptors, and respiratory centers collectively giving us input to your body to assess that there is breathlessness or to understand there is breathlessness. If the mechanoreceptors are affected, you have to find the reasons for that and treat the cause. Then there are perception-associated modulators, where there are drugs such as opioids, which can numb your feeling of breathlessness. And very often today, we are finding ourselves using drugs such as morphine in patients with severe breathlessness in end-stage lung diseases such as COPD, advanced COPD, or in patients with advanced lung fibrosis. And there, what we are actually doing is we are actually numbing these receptors to allow the body to not perceive breathlessness as much as it is. Then there are other conditions such as anxiety and depression, when treated, will help in reducing the perception of breathlessness in a patient. It's very important that when a patient comes to us with severe breathlessness, we often get a psychiatry opinion to understand the patient's level of anxiety and depression, because treating them may also reduce a patient's breathlessness. And there are intrapsychic factors, beliefs, and sociocultural situation which may also contribute to breathlessness. So there are pharmacological treatment for breathlessness where we would give appropriate treatment such as inhalers of different types. Inhalers could be in the form of capsules, they may be in the form of inhalers, which you commonly see what we call pump, or it may be in the form of nebulization. We actively and effectively manage attacks or exacerbations, sudden worsening of conditions such as asthma or severe bronchitis with appropriate treatment, or we treat them with antibiotics when needed during an infection. We often give our patients oxygen when we find that the body's oxygen levels reduce significantly. And there's a very conscious use of medicines such as opioids, example morphine, or even benzodiazepines in patients who may have anxiety, depression, or chronic breathlessness syndrome to help take care of their breathlessness. Now, there are non-pharmacological methods to treat breathlessness, and they would include educating a patient about the disease, positioning, which I'm going to speak about, very often making a patient sit under a fan or allowing a gust of wind go over his face helps in relieving his breathlessness. And oftentimes I find myself prescribing a table fan to a patient so that the gush of air on his face from the table fan will help him feel less breathless. Then there is breathing control techniques, which I will not dwell upon today. There are functional exercises and there are walking aids which can help in managing patients with breathlessness, such as a four-wheel rollator or what we call as walker. There are personalized goals of care. That means to each patient, we will be giving a personalized treatment option. There's symptom orientation. That means the patient will be explained about his symptoms. There's a multidisciplinary approach where a chest physician, a cardiologist, maybe an ENT surgeon, sometimes even a psychiatrist may be involved, along with physiotherapists who are a very important cog in our wheel of treatment. We will maximize quality of life for patients and their families through appropriate treatment. Not to forget that multidisciplinary team will also very often involve a palliative care expert. Maximize the physical and emotional well-being of a patient while being holistic in our care for a patient. So when I speak about how do you manage a patient with breathlessness, you do the stop, drop, flop technique where you ask the patient to stop what he is doing, sit down or lean forward with their hands on their knees or dropped shoulders, then flop by relaxing the muscles around the shoulder and chest, and focus on breathing out rather than breathing in. Because what happens is out here, there is more air trapped inside the lung than there is air to go in. Other techniques are sitting relaxed in a chair or leaning forward while standing on a chair, leaning backwards while we are standing, or forward leaning with your weight on your elbows or lying on your side. These are different positions which help you feel less breathless. It's extremely important to break the cycle of breathlessness because that's the only definitive way to reduce your breathlessness. Thank you. So at the end of the talk, what I'm going to stress upon is keep exercising, keep conditioning your body to a certain level of physical activity such that when you have illness or any kind of disease which prevents you from breathing very well, your body will be adapted to a certain level of physical activity or strain such that you won't feel as breathless. Report symptoms or change in your symptom to your healthcare provider. That means if you have never been breathless, suddenly feel breathless, meet your doctor. Or if you've always been breathless, but you've only had grade 1 or grade 2 breathlessness and now your grade is increasing, that means the change in grade of breathlessness would require you to see a healthcare provider. Excuse me. Seek treatment and comply with the instructions of your doctor. That's extremely important.
Thank you, doctor. Thank you very much for this very detailed presentation. I think most of the questions have been answered. I guess the general questions. There are a few specific questions that have come in. Can I start taking the questions?
Yes, please.
So there is a question from Mr. Sri Krishna Agrawal, who is from Hardoi. And he says his wife, 75, post-COVID, that is May 2021, she had a CT scan of her thorax, and 2022 patchy areas of mosaic attenuation seen in both lungs, small airways disease, subpleural fibro atelectic changes seen in bilateral lower lobes, normal spirometry with poor efforts, low TLC in Feb 2023. Now he says his wife has been advised Foracort 400 with spacer 2P A-2P. Now there are complaints of breathlessness which persist. I know this is a very specific query, but he advises, he requests for some advice on medicines or if there are any other exercises that would help.
So, Mr. Agrawal, I completely understand where you're coming from. Your wife is 75 years old. She is not in the best of physical condition. She is severely deconditioned after her bout of COVID. There are certain changes in the lung, which on the CT scan, which tell us that the tubes are in a constricted state, such that there is air trapped inside the lung. Out here, apart from inhalers of different types, which I will not comment upon, there is an extreme need for conditioning her in the form of physical activities, which specifically revolve around chest physiotherapy, limb strengthening, exhalational exercises, and exercises to strengthen the diaphragm, the main muscle to breathe, which helps us in breathing. Now, if you can get those things in order, your wife's breathlessness will be severely impacted for the better. Yes, and if you have any more questions, you can actually come and show me your CT scan once, and I'll be able to help you in whatever way I can.
Dr. Agrawal, he is in Hardoi, so you can always refer to Dr. Aditya Agrawal by email, and at the end of the session, I will give it to you, as well as when we have the takeaways on Monday, the article will carry his coordinates. Doctor, we have a question from Mr. Bharat Mehta, who's 66. His question is, does pigeon entry in the home, does it lead to lung problems?
Mr. Mehta, pigeon entry one-off does not really affect anybody. What I know why you were asking this question, we actually are living in times when we hear about lung fibrosis everywhere. One of the most common causes of lung fibrosis in the world is a condition called hypersensitive pneumonitis, which is basically an allergic reaction inside the lung. And one of the most common causes in the city of Bombay was actually exposure to pigeon excreta, pigeon poop, or pigeon feathers. Now, the most important factor for this disease has become damp walls and fungus in the homes. But nevertheless, there has been a constant struggle to get where we are. And through several legislations, through several court orders, we have actually been able to get housing societies to stop or prevent anybody from feeding pigeons in the compounds or the societies or the buildings, such that the people who are feeding or the neighbors are not exposed to large quantities of pigeon excreta or bird excreta or pigeon feathers. If you are indeed facing a big problem of pigeons around your home, I would suggest you get nets or get some professional help to get rid of these pigeons.
Thank you. We have a question from Kumkum Bharadwaj. She says she is 75 and was impacted by COVID on return from Australia in June 22. In August 2022, she underwent a single stent operation. Prior to June, she was a regular to the gym for an hour. On her return from a Sikkim holiday in April 2023, she has loss of breath. And even after climbing the Angkor Temple in Cambodia in March 2023, So she is, as you know, a very well-traveled lady, and she loves to travel. And she's wondering why this loss of breath.
Now, Mrs. Bhardwaj does not explain or does not mention when she started feeling the breathlessness, except that I understand that she used to go to the gym for an hour. That was prior to June. I was regular to the gym. That means in June 2022, she was able to go to the gym.
Right.
Now, COVID was one reason why she could have breathlessness. Two, she had a heart disease where there was low blood supply to the heart. Now, this can result in low flow of oxygen to the different parts of the body. Three, because of the heart attack or the ischemic heart disease which she had, she may have heart muscle damage, which can cause long-standing breathlessness. Then, after that, if I look at this, there are several reasons why she could have breathlessness. So these are the two most common reasons which I can immediately tell you for her breathlessness. Now, what we are seeing is there's a change in her level of breathlessness. She could climb stairs earlier, and now she can't. So when I was talking to you about the grades, and I actually repeated that slide twice, is because when I see patients in my clinic, it's quite a challenge for me to impress upon the patients to tell me how their breathlessness changed over a period of time, for the good or for the better. So patients who can explain that, or when they see that the breathlessness is worsening from grade 0 to grade 4, whatever the intervening period is, or from grade 4 down to a grade 0, that will tell us how your breathlessness is either getting better or worse. So out here, Mrs. Bhardwaj, I would only suggest to you is you need to seek out your consult with your doctor once again to know whether it's lung or the heart or both, and have that sorted. If it is permanent heart injury such as cardiomyopathy, I would suggest you enroll yourself in a good cardiopulmonary rehabilitation center and start exercises to help you condition your body to breathe better or feel less breathless. Now, conditioning is extremely important, where I would suggest you start graded exercises where you increase your intensity of exercise over a period of time while only exercising as much as your body can really sustain.
Right. Thank you. We have a question from Mr. S.C. Jain, who's 80. He says he's a chronic patient of asthma. He can walk briskly in the morning, but not walk in the day for more than 150 steps. He is taking inhalation twice a day of Duanil, Seroflow, and Budamate 400. Will use of the nebulizer help him walk in the day as well? He asks. He is retired and moving is not necessary for him. Mr. S.C. Jain, who is 80.
Mr. Jain, I do understand, but this is a problem which I commonly face in my practice, where elderly patients who come to us say that they don't have to move. If you were living in the West and you were living by yourself with no family and no help around, no staff around, you would have to do everything to fend for yourself, including bathing by yourself, cooking by yourself, and doing your groceries. When you are talking about quality of life, I would expect you to be up and about, doing things, meeting friends, going and doing things which will actually improve your quality of life. Now, if moving 150 meters is causing you breathlessness, that means you have a significant grade of breathlessness. I won't be able to comment upon your breathlessness with regards to your inhalers, because I don't know the intensity of the stage of your disease, whether it's really asthma or whether it is anything else, or there are several diseases together which are causing you the breathlessness. The whole exercise of this talk today was to make you understand that it is extremely difficult to understand somebody who's 80 years old and breathless for the first time, or who's been breathless with asthma at this age. So again, I would want you to go back, speak to your doctor, understand whether this is only asthma or is there any other illness which is contributing to your breathlessness. Get that sorted. I won't promise you anything out here saying that changing your inhaler will help you with your breathlessness. As regards as to whether you should be using an inhaler or should you be using a nebulizer, patients who do not have enough capacity to take a very deep breath, or who are very breathless such that they're having very shallow breathing, we usually prescribe to such patients nebulization. Else, patients can also use an inhaler with a spacer device, which is as effective as a nebulizer, but with lesser amount of time spent for therapy. And it also depends upon what drugs you're using and what are the drugs which you need for your medical condition. So nebulization, I would say, would be a good idea if you aren't able to breathe very well. But your problem lies in the fact that we don't have the exact diagnosis right now, or we do not know enough, we don't have enough data about your disease to comment upon what would be the most appropriate treatment for you.
Right, thank you. Doctor, we have quite a few questions. I'll just take a couple of them. This is from Mr. Durga Prasad Rao. He's 71, diabetic and hypertensive on insulin tablets, on insulin and tablets. He had one stent put 5 months back, taking AXA 90 and EcoSprint 75, along with other medicines. Sometimes I have breathlessness at rest too. His pulmonologist told him it is asthma. He didn't have any asthma earlier. He is seeking your advice. He is Mr. Durga Prasad Rao from Hyderabad.
Mr. Prasad, it's extremely difficult to comment upon this. If your pulmonologist has diagnosed you with asthma, I won't comment upon what his diagnosis is because it may be true. You may need to factor in how breathless you are. Is your treatment of asthma appropriate? What kind of asthma do you have? Do you have what we call type 2 high type of asthma or type 2 low type of asthma? It will also depend upon the kind of exposure that you have had. Were you a smoker? Were you not a smoker? Is there any other factor which is affecting your breathlessness? So again, it's a very specific question, very specific to you, and it will be impossible for me to answer without a lot of data points, which I usually look at while treating somebody's asthma. But I can tell you one thing today is that if you indeed have severe asthma, such as what you're describing, or if you've had symptoms of asthma every day for the past 3 months, which aren't going despite all the treatment, then we have several options of treatment, newer treatment options, such as a drug called mepolizumab, which affects or rather reduces your body's ability to produce chemicals which induce allergic reactions, and in the process help you treat your asthma, which is an allergic reaction to stimuli which are particularly noxious to your body.
Right. So quite a few questions are there, but I'm going to ask one question which has been asked by Katie Dadachi about asthma being hereditary. One, and can it pass on from grandparents and parents to the children? And the other question, and this is something that we've invited you for speaking on in the past, on COVID, says since COVID has emerged again in China, should one take another booster, or are there any side effects due to the booster injection?
So I'll take the second question first. COVID vaccination, there is no evidence whatsoever to take more than one booster after the initial 2 doses. Now, I know of several people who have taken booster after booster after booster to no effect. I don't think we should live with that kind of fear about COVID anymore. The COVID that we are seeing today in our country is a very mild variety, more like flu, most often only with upper respiratory tract symptoms, such as your nasal symptoms or throat symptoms. Very, very rarely have we seen anybody coming down with a lung affection with COVID or other systemic side effects of COVID, such as heart disease or strokes. So again, I would suggest you do not strictly take any more booster doses. Now, as far as asthma being hereditary, yes, there's a very strong association of hereditary asthma, and it may be passed down through the generations. But as I very often put it, asthma is a sign of evolution, It tells us that your body is more reactive. That means it responds to subtle changes in the environment better than somebody who is unable to perceive changes in his or her environment. So I wouldn't be scared, or I wouldn't be bothered about somebody having asthma, considering that asthma, if well managed, is a disease which does not prevent you from achieving anything in life. Giving you a simple example, you have several sportsmen, such as Carl Lewis or even David Beckham for that matter, who have performed at the highest level internationally in their fields, such as football and track running, and even gone on to achieve world records with their medical condition, that is asthma. So, asthma is not a handicap. Get your asthma treated right. That will be the goal of your whole existence there.
Thank you very much, Doctor. There is an anonymous attendee who's asked about precautions for her granddaughter who's 8 years old. I guess some of those things you've already said in your talk. Mr. Sudhir Srivastav has sent a very detailed question. I'm going to send it across to you. And then so are a few others. Doctor, thank you very much for taking so much time out on a Saturday evening. And as always, you have been there for us at the times of COVID, when you were busy, so exceedingly busy answering calls, and to, when you've been speaking to us about asthma at least once or twice a year. And thank you very much for always being around for Seniors Today and for our health webinar. And thank you very much to all of you over here. We will be back next Saturday at 5 p.m. As always, our health webinar time, we start on time almost always. And we will be back once again next Saturday. See you then, and thank you once again, Dr. Agrawal. Thank you.
It's always a pleasure to come back. Thank you.
Subscribe now and press the bell icon. Never miss an update.